War Eagle Auburn fans, and welcome to the Everything Auburn podcast, which we record right here from the Heyday Market on the Plains. I'm your host, Auburn Communications Director Preston Sparks. With this segment, we're going to delve into a truly unique community opportunity that Auburn has launched recently, involving the Alabama Cooperative Extension System, Auburn Outreach, and the Auburn Colleges of Pharmacy, Nursing, and Human Sciences. This involves an innovative OnMed virtual care station that is located in LaFayette, Alabama, one of just 4 of its kind in the U.S. We have Rachel Snoddy, Alabama Extension Coordinator for Chambers County, here to talk more about this new healthcare offering that has a lot of potential. Thanks so much for being here today, Rachel. So let's get things started off by having you talk a bit about your role as an extension agent and how you're involved with the OnMed project.
Well, thanks so much for having me here, Preston. So I am the Chambers County Extension Coordinator. In my role, I help coordinate all of our extension programming. And so if you're not familiar with the extensions programs, we have programs in a lot of different areas: agriculture and forestry and natural resources, human sciences, 4-H and youth development, and then community workforce development. I help make sure our programs are meeting the needs of our citizens in Chambers County specifically. And then I also, of course, help coordinate the Chambers County Community Health and Wellness Center, where the OnMed Telehealth station is located.
Such a helpful resource to the community of LaFayette. Can you talk a bit about how long this healthcare station has been in operation, pardon the pun, and walk us through what a person might experience when using that station?
So when you walk into the Chambers County Community Health and Wellness Center, our patients and clientele would sign in with our front desk, and then the OnMed care station is located right in the lobby. And so it's very simple. We rarely have a wait, so they get healthcare access right away. They walk into the telehealth care station and just press a start button on a big screen, and it's very, very simple. People think technology is super intimidating, but that's really all you have to do. The clinician will come on, and all of the clinicians are located in the Tampa area in Florida and work under the OnMed company umbrella. Once you press that start button, the clinician comes on within moments, and they ask you what you're doing in there today, whether it's actually for a health visit or we're still doing demonstrations, so people can go in and just kind of find out what they can do at the care station. And the clinician will walk them through all of their sort of paperwork. So you're not filling out all of that paperwork yourself, sitting in the lobby waiting for hours. And so it's really, like I said, easy to use. And then there's several tools in there based on whatever your symptoms are and what health conditions you're looking at that day. They may use the blood pressure cuff, very simple to use. There's an oximeter. There's an HD camera they can deploy so they get a closer look if you have like a skin rash or if you have to look down your throat. They have infrared camera technology to look at your body temperature, of course, but also it can detect inflammation sites and infection sites. And so if you have an ear infection, it might show up white around your ears or like around your nasal cavity if you have a sinus infection. So they can detect all of that within the station. And of course, they also have a stethoscope that they could deploy if that's needed to for lung and heart monitoring. So all the technology is right there in the unit to look at about 85% of what you would normally see at a regular doctor's office. So it's pretty amazing.
That is one of the coolest things I've heard. That is just amazing. Like, the future is here, right?
Right, for sure.
So let's talk now about how this project came about. Let's talk a little bit about, how it was brainstormed. Why LaFayette? And what's the ultimate goal you hope to achieve?
It started with Auburn University Outreach finding this technology with the OnMed care station and their company. They thought this is really kind of amazing, and we could really utilize this in rural Alabama because there's a lot of healthcare deserts in Alabama. And so they tried to figure out where to put it, and they reached out to Extension since we are under Auburn University and we have an office in all 67 counties in the state. And so they looked at us to see where would be a good fit because they wanted to meet the needs of our citizens as far as find locations that didn't have a lot of healthcare access, that had a lot of health issues, and people with a lot of health problems. And so they looked at all of that data and they finally landed on LaFayette because they also wanted to make sure it was somewhere relatively close to the university since this is a pilot project. And they wanted to be very hands-on with the project, so they had to make sure they were in close enough proximity where they could have their faculty and students involved with wherever they put the care station. And so that's how LaFayette was chosen. And so as far as our goals for this is we're wanting to improve the health of our citizens. Having this additional resource for our communities, people can go in with any kind of health issue that they're having to get checked out. Of course, it may need a referral, in which the OnMed Care Station can do that. They can get prescriptions written for them there and sent to whatever pharmacy they choose. Eventually, we'll be able to actually deploy prescriptions right there on site once they get approved by the state. And so, but just hopefully we will be able to make our citizens healthier.
So tell us a little bit about the network of doctors who are involved with this station, kind of how that works.
So when you're in the OnMed Care Station itself, like I said, those clinicians are based out of Tampa, but they are licensed to practice here, obviously. And then in addition to the Telehealth Care Station, we have several clinic rooms and like a hearing booth space that we are able to use within the Chambers County Community Health and Wellness Center. And this was a vacant building before Auburn got involved. And so this is all built for Auburn University Rural Health Initiative. And they have worked with several colleges, the College of Pharmacy, College of Nursing, College of Human Sciences, but also we have buy-in from other departments as well that come to the center to do clinics, screenings, vaccination clinics for the citizens up in the Chambers County area. Of course, we don't care where the people live. They can come from all over. And so several departments have come up to do screenings such as hearing and speech screenings. They've been very involved from Auburn University. And vaccination clinics, nursing has come and do various health screenings. We've had nutrition interns come up and help man the station, and then also create publications for us to help increase the health of our citizens, whether it's like nutrition based on diabetes or hypertension, that kind of thing. So the students and faculty have been very, very involved, and we look forward to them being even more involved because they are starting to come more regularly to the station so that we can better serve the citizens of our county.
I love the partnership component of this, working with various colleges and units, as you mentioned. So just a little bit further delving into that, can you talk about that learning component for the students?
So they get an opportunity to get away from campus and get really plugged into the community and see what rural Alabama is really like and how these people don't have that close access and can run to the doctor very easily anytime they get sick. And so they may see a little different kind of treatments at home and hear those things from the patients that come by. And maybe those aren't the things they should be doing. And so these students are able to get that interaction to be able to correct some of those home remedy type solutions to health and help them get healthier faster.
Are there plans to have more stations like this throughout the state?
Yes, absolutely. Auburn University has part of their rural health project. They are looking at adding 4 more across the state, and this is all very new, and so we don't have those communities selected yet, but we are looking at sort of the same criteria, is communities that don't have a lot of healthcare access and have a lot of health issues. And so, we'll have 4 more across the state in the next couple of years.
Wow, that's great. That would be wonderful to have that, broadened throughout the state like that.
Oh, yes.
So in addition to this effort, can you talk a bit kind of about your overall role as an extension agent? How Extension is an unbelievable resource to the communities of Alabama?
So Extension, a lot of people think of us as agriculture, and we are, but we do have so many more programs than related to just agriculture. For example, our 4-H and youth development programs cover a lot of STEM programming, which is very popular right now. A lot of teachers request that from us. And we also have a lot of human sciences programs related to health and nutrition and to help make our citizens healthier, just like the university is doing. So we have a lot of programs to serve the communities in Alabama, and we do a lot of community development projects as well, like this one. But also it could be, we have agents around the state who are working on projects to maybe put in better park systems in their communities. And it could be, or helping new businesses. We have a lot of workforce development programs or entrepreneurship programs. So we have a lot to serve the citizens, and it's different. Every county is different in the state of Alabama, and so every county's extension office looks a little different in the state because those communities have different needs. And we work our hardest to try to figure out what those needs are and help with whatever projects we can.
So that's really the land grant mission in action, right?
Absolutely. Our goal is to improve the lives of our citizens.
So finally, are there ways in which the community can connect with Extension or help support this OnMed effort?
Absolutely. So, of course, connecting with Extension, we all have a Facebook presence. Of course, you can see what we have going on, whether programs in your area about what interests you or your children. And then as far as the Chambers County Community Health and Wellness Center, we also have a Facebook page, and we have a new Health Ambassadors program. And so if people in Chambers County want to volunteer with us, to help us go out into the community at community events to help advocate and let people know that the center exists and that it's currently no cost to use the health center. Then those health investors help us get that word out.
Okay, no cost. That's good.
Yes.
So anything else you'd like to add about Extension or just OnMed or anything in general for the listeners?
One thing that I forgot to mention was how long we've been here. You asked me that and I completely went over it. The Chambers County Health and Wellness Center has only been open since February of this year, 2023. Okay. At first it was just demonstrations to let people know what was going on as we were finalizing some installation technology pieces of the unit, but it's been open for health visits since March 1st of 2023, and so it's all very new, and we are still learning and still getting the word out, but so far so good. And OnMed actually says that we are the most active station that they've had in the whole country, so it's obviously something that was really needed.
Well, this has been amazing. Thanks so much, Rachel. We really appreciate you joining the podcast and enlightening us on all things OnMed and involving Extension. We really appreciate it. Hope everyone listening learned a few new things, grew their knowledge of everything Auburn. Make sure to check back on our show for future episodes as we continue to look at everything that makes Auburn so special. War Eagle.
War Eagle.